Hi everyone, my name is Ghazal. I'm a third year public health sciences major, and I'm going to analyze the case of multi-state outbreak of Salmonella Tennessee infections linked to peanut butter. Step number 1, background information. In November 2006, the FDA and CDC public health officials considered a big increase in Salmonella Tennessee cases. This was specifically due to the consumption of two brands of peanut butter produced at the same plant, the Peter Pan peanut butter or the Great Value peanut butter. The illness was actually linked to the consumption of peanut butter more than once a week. Fortunately, no one died because 78% of infected individuals received antibiotics. The median age of infected individuals was 52 years old. 27% of infected individuals were males and 73% were females. The symptoms of the disease include diarrhea, fever, and abdominal cramps. Step number 2, the current situation. The problem was that prior to the outbreak, non-animal sources were not believed to carry salmonella. The strength was that the CDC was able to quickly detect the problem and treat the individuals using antibiotics, and that is the reason why there was no deaths. The weakness was that consumers were unaware of the contaminated products and continued their consumption. The opportunity was the availability of education to the public and raising awareness. Because CDC posted weekly reports on their website, and the threat was the increase of salmonella infections nationwide. The mission of CDC was to identify the production issue that caused the contamination of Peter Pan and Great Value peanut butters with Salmonella Tennessee and to eradicate the disease. Step number 2, prioritizing core issues. There were a total of 628 infected individuals in 47 states. The main cause of this outbreak was the environmental contamination in the peanut butter plant. This outbreak showed the risk of salmonella in heat processed foods of non-animal origins. This was actually the first time that salmonella was found in non-animal origins, and the non-animal and non-agricultural origins are not considered to be the typical sources of salmonella. So the public was actually unaware of these sources. So it was very important to prioritize education and raise awareness. Step number 4, alternatives. The case solution was that FDA and CDC officials worked together with peanut butter manufacturers to learn more about production of peanut butter and to identify how it was contaminated. Also, the health belief model can be applied to educate public about possible risks of salmonella infection and how they can change their behavior. The two other approaches that can be used are improving the training of the food manufacturing company's employees, because the environmental contamination might have been due to the lack of awareness of experience of the employees. The other approach is inspecting the food manufacturing products biannually. Step number 5, recommendations. So the first recommendation is to improve and encourage communication with frontline employees, because they need to understand how to carry out different policies and regulations when it comes to the disease. The other recommendation is to increase media exposure, because media exposure makes people aware of the problem and it makes them avoid the consumption of the product faster and decreases the incidence of the disease. This can also lead to many other positive health behavior practices, such as hand washing and stopping the consumption of unsafe foods. Step number 6, the action plan. So the first thing we need to do is to make the consumers aware of the recall so that they can stop their consumption as soon as possible. Some examples could be organizing different education campaigns or providing brochures to educate the public for 6 months. The next step would be identifying and testing individuals who purchased the two brands, the Peter Pan peanut butter and the Great Value peanut butter. The third step that is for 6 months. Then we need to treat the infected individuals for a year. Then we need to campaign for stricter FDA policies and regulations for a year. And then the last step would be to analyze the results for 6 months to test the effectiveness of our approach. Step number 7, finalization and opinion. Before reading about the Tennessee outbreak of Salmonella infection and analyzing this case, I was actually unaware of the non-animal and non-agricultural origins of the disease, and I didn't know that there are various subtypes of Salmonella and that specific testing is required for the proper identification of the specific subtype. So now that I know this, I think it is very important to make more public health announcements about the different sources of salmonella to make sure that more individuals know about the various sources that are actually existing. Also, although this was a very terrible situation, I feel like the positive from this was that more effective regulations for manufacturers in the production process were created through this outbreak. This is my references slide, and thank you for watching my presentation.